Welcome to the University of Houston. This presentation will provide you information about the Student Health Center, campus pharmacy, and the UH system-endorsed student health insurance plan. This information can also be found at uh.edu/health center. The Student Health Center serves as your convenient on-campus provider of healthcare services. We offer non-emergent outpatient medical care and specialty clinics. The Student Health Center is not an urgent care or walk-in center, emergency room, or extended hour, 24-hour facility. Appointments are required for all services. You will be cared for by board-certified physicians, nurse practitioners, pharmacists, licensed nurses, medical assistants, and administrative staff. The Student Health Center is located at 4349 Martin Luther King Boulevard on the second floor of the Health 2 building, behind the Health 1 building and the University Eye Institute. The campus pharmacy is located on the first floor. Parking is available in the Health 1, Health 2 patient parking lot for patients who have an appointment with the Student Health Center or are visiting the campus pharmacy. You may only park in this lot during the time of your appointment. Go to our website for directions, parking instructions, and a link to our location on the campus map. In-person and telemedicine appointments in our primary care clinic can be scheduled online using the Healthy Cook patient portal or by calling 713-743-5151 during regular business hours. Walk-in services are not available. Same-day visits are usually available, but urgent concerns are prioritized. We strongly encourage you to schedule your same-day appointment as early as the day as possible. Be advised that if you wait until the afternoon to try to be seen, there's a possibility our appointments will be completely booked for that day. Routine and annual exams should be scheduled in advance. In a psychiatry clinic, our board-certified psychiatric physicians see students for evaluation, medications, and referrals. Appointments are required. Call 713-743-5149 during regular business hours for information or to schedule a telepsychiatry appointment. Typical problems that we treat include mood disorders, anxiety disorders, post-traumatic stress disorders, attention deficit hyperactivity disorder, eating disorders, psychosis, drug or alcohol abuse, and psychiatric issues. In our orthopedic clinic, our board-certified specialist is available to diagnose and treat musculoskeletal conditions. This includes sports injuries and diseases of the bone and muscle. Referral for physical therapy may be obtained through this clinic. This clinic is limited to those referred by a student health center physician or nurse practitioner and visits by appointment only. You can find information about the Student Health Center and other health-related links on our website at uh.edu/health center. Access to our Healthy Cook patient portal can also be found on our website. You can also find us on the UH Go app or Access UH. The Student Health Center does have charges for services including office visits, medications, laboratory services, procedures, and injections. The only insurance plan accepted at the time of payment is the UH system-endorsed student health insurance plan. Patients not enrolled in the student health insurance plan are offered the self-pay, discounted rate, and must pay at the time of service. If you have private insurance that is accepted by Quest, ask us how your lab test can be billed to your insurance through Quest Diagnostics. The campus pharmacy is committed to excellent inpatient care. We believe strongly in educating patients about their medication, including proper use, length of therapy, side effects, and potential drug interactions. The campus pharmacy limited formulary carries a variety of both prescription and OTC medications at competitive prices. Valid prescriptions are accepted from any physician licensed to practice in the United States. Prescriptions can be faxed or phoned in by your provider, and our pharmacy also accepts electronic prescriptions. The campus pharmacy accepts most insurance plans for prescription coverage. Many insurance companies provide a special card for pharmacy use to be presented at the time of service. Contact your carrier, or we can assist you in verifying your coverage. The COVID-19 vaccine is available in our area. If you need to get the COVID vaccine, you can text your zip code to 438829 to receive a list of vaccine sites near you. If you are experiencing a medical emergency, call 911 or proceed to the nearest emergency room. If you get sick or injured after hours, on weekends or holidays, and you'd like to be seen by a physician, you may seek off-campus health care at an urgent care center. Go to our website for more information and links. Make a healthcare plan before you need it. Store the contact information in your phone for the Student Health Center, as well as your local area convenient care, urgent care, and emergency room. Also include the nurse line for your insurance plan or the Memorial Hermann nurse line at 713-338-7979. Know your telehealth options and register now before you need to use it. If you have insurance, verify where your insurance card is accepted and carry a hard copy of your insurance card with you at all times. Keep a first aid kit including bandages, fever and pain reducer, cold medications, and a thermometer. Understand the difference between an urgent care center and an emergency room. It is very important that you understand the difference between an urgent care center and an emergency room. When do you go to urgent care? When it's not an emergency, but you need immediate care. They can provide care when your doctor is not available and generally include evening, weekends, and holiday hours. Some examples would be minor cuts and burns, sprains and strains, sinus infection, earaches or infections, eye infections such as pink eye, rashes, allergies, non-severe headaches, and pain. They offer walk-in services, are less costly, and you can usually be seen more quickly than an emergency room. When do you go to emergency room? You go to emergency room for life-threatening symptoms. They're open 24 hours a day, 7 days a week. Some examples would be heart problems, heart attack, chest pains, stroke, breathing problems, broken bones, head injuries, severe bleeding, severe burns, poisoning, seizures, and sudden or severe pain. The cost is 2 to 3 times higher than an urgent care center. Do you use social media? Check us out on Twitter, Instagram, and Facebook. Thank you for your time, and again, we would like to welcome you to the University of Houston.